Hello, my name is Dr. Mark Povroznik. I'm the Chief Quality Officer for WVU Medicine United Hospital Center and the Chairman of Infection Prevention. Today we're going to talk about flu vaccine and some of those common yet important questions that are on the minds of the public as we start the new flu season and still deal with a COVID pandemic. Flu is a contagious respiratory illness caused by influenza viruses, and viruses being plural, as there are several strains that the virus can circulate together or cycle throughout each given year. With the pandemic of 2019, we can no longer speak about the flu without parallels to COVID-19. The public in general has acquired some pretty good infectious disease knowledge and practices after more than 18 months of pandemic life. And influenza viruses, like COVID, spread the same. They infect the nose, the throat, sometimes the lung. It can cause mild to severe illness, and at times it can contribute to death. Flu viruses spread mainly by tiny droplets made when people cough, or they sneeze, or you're talking too close to an individual, and these droplets can land in the mouth or our noses if we're nearby. Less often as a person might get the flu by touching surfaces or objects that has the flu virus lying on it, and then touching their own mouth or their nose or possibly their eyes. This is what we commonly call the T-zone. And keeping our hands away from this zone until they're clean is a way to prevent viral spread. Symptoms of the flu are synonymous with many respiratory viruses. As a consequence of the pandemic, it will be virtually impossible to distinguish the particular virus without the assistance of laboratory testing to aid in the diagnosis. And because there are effective therapies to support earlier recovery, like antivirals for the flu or monoclonal antibodies for COVID, timely diagnostic testing can be helpful to minimize illness severity. Symptoms of the flu usually comes on quite suddenly. People who have the flu often feel some or all of these symptoms. Fever or feeling feverish, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue or just feeling tired. Some people may even have vomiting or diarrhea, though this is more common in children than adults. Even loss of taste and smell that we saw with COVID can occur with other viruses. And it's important to note that not everyone with the flu will have a fever. It's also important to recognize because of so little disease last year, population immunity is likely lower, putting us all at a higher risk of increased disease this year. The United States already saw a similar pattern with the spring and summer resurgence of the common virus respiratory syncytial virus, or RSV. Flu seasons are notoriously difficult to predict. As a result of the global pandemic and the myriad of infection prevention measures that we have enacted, it has made predicting when the flu season will start and when it will peak more speculative. Traditionally, we have followed disease severity in the southern hemisphere to provide insight into the northern hemisphere. These early indicators have been disrupted, with the southern hemisphere experiencing atypically low flu activity for the past 2 seasons now. Most experts agree another non-existent season is unlikely. Other evidence suggests that the upcoming one could be typical or milder than normal. Respecting that a significant flu season could cause havoc, we should put forth our best efforts to avoid a twindemic of continued COVID along with influenza. With a previous mild season, perhaps lowering immunity, we should not let down our guard, especially for children. While one child died in the 2020-21 flu season, let's recall nearly 200 died the year before. At this time, it is best to follow surveillance monitoring, including areas you plan to travel. Continue practicing virus transmission prevention that we've learned clearly through the pandemic. Get vaccinated against the flu, and stay home when we feel ill to minimize virus spread.